Yes. Are you able to see the slide?
Yes, ma'am.
Just wait.
Yes, ma'am.
Started your 2 minutes time. Two more pages, huh?
Okay, ma'am. Can I have first page? Yes, ma'am. Next slide. Yes, ma'am. Next slide. Any other slide, ma'am?
No.
Yes, ma'am.
Time has to be completed. Organize yourself.
Yes, ma'am.
10 minutes. Started.
Hi, I'm Dr. Shaisa, one of the doctors in the contraceptive clinic today. May I confirm your name and age, please?
I'm Heather and I'm 34 year.
Sorry, this is Gynae Clinic. Uh, how can I address you?
Heather is fine.
Sorry.
Heather is fine.
Nice to meet you, Heather. Heather, I would like to know that today you are here to discuss about your options related to contraception. Am I right?
Yes.
Any other expectations apart from that?
No, doctor. I just wanted to know safer options. Actually, I'm very keen on pills. I don't know why the GP said that I need to see you.
Yeah. In a short period, I'm going to discuss all the options. Um, but before that, is it okay if I ask you a couple of questions to know more about you?
Yes.
Okay. So, may I know um, what kind of contraceptives are you interested? Why are you interested in the pills?
I always find it very easy, doctor. Means we can pop it on day-to-day basis, and once we are not keen, I can stop it. So it's having a total control, and I can
Um,
remember it very easily. So I think it's a good option for me.
all right. And could you tell me more about your periods? How are your periods?
Yeah, my periods are pretty regular. First of my period is little bit heavy. Apart from that, I get the periods bang on time, and my last period was 2 week back.
Mhm. Otherwise, your periods are regular,
Yeah,
only heavy periods, right?
yeah, 1 or 2 days.
Okay. Is it affecting your quality of life because of heavy periods? Any
No,
difficulty?
no.
Okay. Few of my questions might be interesting. Can I proceed, Heather?
Yeah,
Um, are you sexually active?
doctor, I'm having 2 kids.
Mm-hmm. So how are they delivered and how old are they?
Yeah, both of them are fine. The elder one is a 8-year-old, the younger one is 4-year-old. They delivered by C-section. First C-section was done because I was stuck up at 6 centimeter, and the second was planned C-section.
How was the recovery afterwards?
Yeah, things were pretty normal. Nothing, there wasn't any concern.
Okay. So did you use any contraceptives before that?
Doctor, actually, I used condom. My husband used to use condom, and I was not very, means I'm not very sure whether I would like to go for another baby or not.
Okay, so you didn't plan so far, right?
No. So that's the reason I'm not going for a permanent method. Otherwise, my husband is very keen for vasectomy.
Okay. And if you otherwise, do you have any vaginal discharge?
No,
Pardon me for asking if you or your partner been treated for sexually shared infections in the past.
no.
Hmm. And what about your cervical screening?
Yeah, it's normal.
Hmm. Do you follow your GP for any medical problems?
Oh, yeah, actually, doctor, I do have high blood pressure and I do have diabetes. My both the parents are also having diabetes. My sugars are pretty controlled on metformin. I take it twice a day, and BP is controlled on methyl dopa, which also I take twice a day, 500 milligram. One more question thing is that when I was pregnant, I don't know why, but they had given me this blood thinner.
Okay. Do you have any idea why they did it?
No, no.
Okay, no worries. I will check your notes. Would that be okay?
Yeah.
Any history of clots in your family or personal history of clots in the
No,
legs?
no. My parents are also having diabetes. Apart from that, nothing.
Mhm. Okay. And few personal question. Do you smoke or drink alcohol?
No.
Are you allergic to anything?
Yeah, I'm allergic to aspirin.
Okay, I'm going to note down. And apart from that, are you on any medicines currently?
I told you, doctor, I am on this methyl dopa and metformin.
Apart from these medicines, any other
No,
medicines?
no.
All right. And how is the support at home otherwise,
Yeah, my
Heather?
husband is very supportive.
Oh, good to know that. And have you ever felt down, depressed, or hopeless in your last couple of weeks?
No, no,
Your BMI?
no.
Your BMI, Heather?
No, I don't know.
Okay, today we will check, no worries. Thank you very much for the information. Would you like to add anything else?
No.
Mm-hmm. Heather, I am going to check you in the presence of chaperone. My nurse will check your general well-being, your pulse, blood pressure. We will check your weight today as well. And I will see you from down below. If you have any discharge, I will take the swabs. Would that be okay?
Yeah.
Okay. So, as you are interested in contraception and you intend to have for a longer period, so I am going to discuss. Would you like someone to be with you because I have to discuss a lot?
No. No.
Okay. So Heather, we have number of options for the contraception. We have hormonal contraceptives, non-hormonal contraceptives, and we have permanent methods as well. Permanent methods are not suitable as you and your partner both are not willing for that. Am I right?
Hmm.
And hormones, we have hormones in the form of tablets, in the form of injections, implants. But I'm afraid they are also not suitable in your case. Is I don't know exactly your weight, and you have high blood pressure, and you are diabetic, and you have a strong family history of the same medical problems. So we really don't recommend. Otherwise, there will be a risk of complication, and moreover, you had previous thromboembolism, clot formation. So in
No,
that
I
case,
was not. I never had a clot formation, but they put me on this low molecular heparin.
all right, all right, okay. So I will check why they put you on low molecular weight heparin, and in that case, you might need further investigations. So, apart from hormones, we have long-acting reversible contraceptives. We have in the form of coils, like we have copper coil, and we have one hormonal coil that is Mirena. Both are suitable options
Hello.
for you. Hello.
Yeah.
So, copper coil is suitable in your case because it doesn't contain any hormone. It is harmless in relation to your condition. And
Okay.
would you like me to discuss these options?
Yeah, doctor, you're so okay. You can explain me what actually.
Yeah. So the device, actually, we will put it inside the womb. This is a T-shaped device. It is suitable for
Mhm.
5 to 10 years, and moreover, like any medicines, it is not without risk. There is a risk of little bit erratic bleeding for few months, and sometimes small risk of infection, and sometimes it expelled out in 1 out of 20 cases. But we will monitor for that. How it how it is effective actually, it prevents the meetup of the egg with the sperm, and it is toxic to the sperm, and if there is a pregnancy, then it prevents its attachment with the lining of the womb. Am I clear up to now, Heather?
Okay.
uh, and moreover, after this coil, you have to check the thread every time after your periods to see if it is missed or not. If it is
Mhm.
missed, you have to inform us. Okay.
Okay.
There is a small
So
risk.
will it affect my diabetes or high blood pressure, doctor?
Not at all. It will not affect your diabetes and hypertension.
And will
And
it have any effect on my bleeding?
yeah, I told you it. There are sometimes there is erratic bleeding for few months, but after that it becomes regular. Okay.
Okay. And any concern with return of my fertility? Because if at all, I would like to go ahead with
Uh,
pregnancy.
as I told you, it is a good long-term contraceptive after removal. Pregnancy is possible then and there. But one more thing, after insertion, there is a small risk of ectopic pregnancy. This is the pregnancy outside the womb. For that, any time, if you suspect that your periods are prolonged or you have tummy pain after missing of your periods, you have to inform us. We'll check your pregnancy test at that time. Okay.
Okay. So are you going to put it right now?
Today is your 20 days of cycle. So you have to come after your next menses immediately, and you have to avoid the intercourse in between. And on the last day of periods, it would be more easier for us to insert the coil, and because there will be no risk of pregnancy. And moreover, I will check your one hormone, that is thrombophilia screening. Uh, I'm going to ask my nurse to collect your blood for this investigation. Would that be okay?
Yeah.
Okay. So first we will check your report, how it is, and even if this is not satisfactory, in that case, this coil is very safe. Do you
Okay,
have any
doctor.
more
Thank you.
questions?
Thank you.
Thank you. I'm going to give you some information leaflets related to the contraceptives, long-acting reversible contraceptives. And if you have any concerns, please let me know. I'm always here to help you out. Okay.
Thank you, doctor.
I'm going to fix your next appointment after your next periods. Please let us inform on phone when you had your last menses, so we will book the appointment. Thank
Okay.
you.
Thank you. Okay. Dr. Shaista, a good presentation. If you have not prepared, still you had come to this, I will definitely suggest this is a good presentation.
Thank
Only
you.
concern. What is quick starting method?
Sorry, ma'am.
What is quick starting of contraception?
What is the ma'am? Sorry,
Quick start. Quick start contraceptive options.
ma'am. I don't know.
Anybody can comment?
Anytime patient can be started contraception. Uh, like once the patient comes, we can rule
The
out.
time of the cycle it started without waiting. No.
Yes. So quick start is whenever patients presents to you, you can start that method and check urine pregnancy test and give her instructions. If you will miss out on period, come back to us. That is quick starting. You
Ma'am,
mentioned
sorry, ma'am. FIX fixed starting, or what is the
quick,
spelling?
quick, quick, quick.
Oh, quick, excuse me. Okay,
Yes,
sorry, ma'am.
just
Sorry.
read this FSRH
Yeah,
guideline.
quick is started. Sorry, ma'am.
So rather than sending her home, I would have said that I said that day 14, it was not day 20. If it would have been day 20, I would have offered her urine pregnancy test and I would have inserted it and told her that watch for your next period. If missed out, do UPT. If it is day 14, then we can very safely insert because it will act as an emergency contraception also. What are your say about
Yes.
it?
Okay, right,
Okay. So
right.
that is only one concern what I wanted to tell you. And one more thing is that it would have been very good if you would have explained me, checked my knowledge about LARC, LARC, and explained me about LARC. Okay, I'm okay. Means, see, I would have said that LNG IUS would have been a better option in her case because she's having a heavy bleeding. Somebody will go for copper coil. Okay, so that is a different issue. In here, RCOG will not have means a big say. So far as you are safe in both the options and you are giving her, prescribing her a safer contraceptive, it's okay. Same LNG IUS, why it will be because that bleeding will be controlled as of now, no thrombophilia is, I mean, there is a possibility. So arranging a thrombophilia screen and going for IUS, okay. It will not have any impact on diabetes and it will not have any impact on hypertension because it's a local hormone releasing thing. So that is the only thing what I am in favor of LUS, LNG IUS rather than copper coil because already she is having a heavy period. With copper tea, the periods will be a little more heavy.
Right.
Okay. Yeah. So that is the only worry. If my periods would not have had been heavy, I would have prescribed her copper coil. This is my personal way. Uh, and that's the reason even the answer key is also about LNG only. But still, I will not say that I will fail you or I will give you borderline. I will definitely pass you overall in this task. It was a wonderful task. Only thing you didn't explain me regarding LARC, what is LARC, and you didn't check my knowledge about LARC. Very nicely, you had asked me what were my previous contraceptions, which that is one of the important history or information gathering point. So overall, a good station. Anybody would like to comment about her performance? Anybody will come up with their own observation?
Thank you.
Anybody? Almost well within time, but history time taken for history taking was very uh, means prolonged. So 5 minutes 15 seconds. So see to it that you will minimize it.
Yes.
Ma'am, any need
Hmm.
to mention about uh, implant, ma'am?
Implant is also safe, I feel, because in the book they have not given, but in my answer key, I feel that implant and implant-on is also a safer option in her case. If her BMI is normal, then that is also a safer option.
Thank you, ma'am.
Yeah. Anybody wanted to put anything? We will go ahead then. Anybody? A good presentation overall, Dr. Shaista.
About injections, we should tell, ma'am.
DMPA will not be a good option because see here actually they you have to tell her all the options about LARC. What are the options available in LARC? My answer key includes all those things. I tell her what is LARC. Okay. Why we are in favor of LARC? It is reversible, more effective than a permanent sterilization or permanent contraception, and you have to take it means less frequently. Options
Mm.
are available hormonal and non-hormonal. Hormonal basically in the form of implants, injections, and intrauterine system. And non-hormonal is copper coil. Okay. One point at least you can tell her that these are all hormonal containing. Implant is means implant on also or in dermal implant is also safer option in her case. I don't know why the answer key was not including that, but I feel it is a safer option. I read about it and I didn't say that means I haven't found any contraindication to that. The answer key includes LNG-IUS because she is having heavy period. It is having a local action, and if at all thrombophilia positive, then we can think about any alternative options. But as of now, we are just going to screen her for thrombophilia. We are just going to offer her urine pregnancy test. If she is more than 14 days post LMP, that is safety, pros and cons of the options what you are going to give her, and telling her that other options are not suitable, especially COC. It is not suitable in her case. So that is what the whole task is about. Okay. My concerns here are, I would means whether whenever I will need to stop it, whether my fertility will return back. Yes, it will be returning back. LNG, Implanon will not return back your fertility. That is one side effect of Implanon. Okay, even DMPA also, Implanon in injection DMPA, the fertility may take longer to come back. Diabetes and hypertensions will be getting affected by this injectable DMPA. Chances of weight gain will also be there with injectable DMPA. So those are the side effects of injectable DMPA. Apart from that, I don't think there is any concern. LNGIUS, yes, it will affect, it will minimizes your bleeding, what you are having as of now. The risk, the complications or the side effects of this procedure are infection, expulsion, very rarely perforation, and if at all you will get pregnant with this contraception, the chances of having ectopic pregnancy. That are the cons with this thing. And unscheduled bleeding, that is a side effect. Okay, unscheduled bleeding, what you can expect, and it might be, sometimes it might be distressing symptoms for you. So those are the points with what you are supposed to tell her. Anybody wants to say anything? Shall I go with the answer key? Sorry. It was a gynae clinic. Very nicely, you remember that. Oh no, it was not a contraception clinic. And discussing contraception as per GP letter. Writing back to a GP, you forgot. You forgotten, dear. You documented. You had offered me PIL many a times. In spite of having a GP letter, many people just forget about communicating back to the GP. Any particular choice and why? So here actually concern is any particular choice of contraception and why it is why that is a your option. History of present illness, menstrual history specifically, very nicely you had asked, started from an open question. Intermenstrual bleeding could have been asked, but it's okay because I told you, I had given you complete history, smear, previous contraception used, and STI also you asked me. Ops history, I find that sentence very offending. Are you in a sexual relationship? What was your question, dear, there?
I told, are you sexually active?
Yeah. So rather than that, you could have asked me, mm, means have you used any previous contraception?
Yes, ma'am, because I have to rule out only this STI. That's why I
Yeah,
wanted.
yeah,
Yeah.
yeah. So have you used any previous contraceptions? What contraception you had used? So this is going to give you a sexual activity of this patient. If she has used contraception, that means she is sexually active. And if she is sexually active, then you can ask her whether there was any history of sexually transmitted infection in you and in your partner. Have you ever been pregnant? That would have been an ops history. Okay, that would have been ops history. MOD, last childbirth, breastfeeding. That is another point which you can ask here whether she has breastfeed. So most of the time I was breastfeeding, and then the contraception was used by my partner, that is condom. That history also you elicited very well. Medical surgical history, blood clot history, family history of blood clot. You elicited LMWH, accessing case record very nicely. You have done it. Allergy, smoking, BMI, alcohol, occupation you missed out. Family history of DM, cancer you missed out. High BP. Okay. Any specific concerns she is having? So I was having multiple concerns which I asked eventually. You offered me examination, that was you have to say, I didn't mention here swab, but yes, because why it is needed to include swab in the answer key if we are going for a intrauterine device. It's always better that we will take a swabs, or if there are any signs or symptoms of any vaginal discharge, antibiotics needs to be started for this patient. Any active infection, we need to treat a infection and then we can offer a contraception. Okay, so that swab was very good point what you had added here, dear. Very nice. Now checking background knowledge about what are her thoughts about COC. You can ask her what are your thoughts. So my thoughts are, yes, I need to. I have means many people are using around me, and then they are taking it very because already I'm taking 2 pills, so it will be easy for me to remember one more pill. I don't have any means specific thing about that. And I think whenever I will stop it, I have a control of getting pregnant. Uh, Acknowledge that okay, whatever your thoughts about COC are correct, but it's not a suitable option in your case because of high blood pressure, diabetes. BMI might be higher side because it was not given in the task, and her age is also on a little higher side. History of low molecular weight heparin in the pregnancy, all these risk factors make it a non-suitable option in her case. So if she is keen, we can discuss about LARC. Take a permission here. Check her knowledge about LARC. What is LARC? LARC is long-acting reversible contraception or very effective birth control methods. When you use one of these, you do not have to rely on remembering something every day. They last between 2 to 3 months to 10 years, depending upon the options you used. Mm, Different forms. Okay, so injection, implants, and devices which can be put into your womb. Here you can take a help of drawing. There are 4 types of long-acting reversible contraceptions. Contraceptive implant, a minor procedure. If you think you are having a time, then only you are going to explain it. If you think no, you don't have a time, then you can just quickly take her through implant, which will be put in inserted into the skin. Injections, which needs to be taken every 2 to 3 monthly uh, into your muscles, and intrauterine devices or intrauterine system, which need devices used copper as a substance, and system uses progesterone as a progesterone hormone, and this needs to be IUCD needs to be there for 10 years, and intrauterine system will be there for 5 years. So out of these options, the IUS or IUCD, these are the two safer options in your case. Under all aseptic precautions, once we will rule out any infection, we can insert it inside your womb. You can draw it and then tell her that what are the side effects. So copper coil or LNG, as heavy bleeding will be tackled at the same time if we will be going ahead with LNG IUC. Small OPD procedure under all aseptic precautions, no side effect like blood clots formation or any concerns, slightly raised chances of infection. So we will start her on antibiotics. And if there is any possibility of pregnancy, we will offer you urine pregnancy test. If copper coil will be inserted, it will be effective from the moment of insertion. If there will not be any ongoing pregnancy, but if at all LNG IUS will be inserted, then it will take at least 7 days to act. Okay. Very effective. Once inserted, keep a watch and string by inserting finger in vagina. If not felt, report immediately. If miss out on your period, report, do urine pregnancy test, because at risk of ectopic pregnancy. That is another important positive points we have to say here. Do you wish to discuss further? Yes, return of fertility is immediate, and since it's a local system will not have any adverse effect on your diabetes or high blood pressure. I will share PIL of intrauterine system of FSRH, and if you accept, we can go ahead with the procedure. I will revert back to the GP and document your consent and go ahead. Okay, that consent part is also we need to explain here. Overall, a very good task. You have done it. Communication with patient and relative. Various options outline the rationale for why the other forms are contraindicated, especially COC. So you just need to tell her COC is not a safer option in her case. Brush up with 2, 3 means you just take a name of a LARC and most suitable option. Give her pros and cons. That will be sufficient enough in this task rather than explaining detail about other contraception, other LARC options. Okay, able to identify, choose a method for patient, that is copper intrauterine devices best option followed by LNG IUS. Okay, so this is also a safer option, this is also a safer option, but in my answer key, why I took a LNG IUS, because of this her bleeding problem. Copper coil will increases her chances of bleeding. So LNG-IUS and copper coil. So copper coil followed by LNG-IUS. These are the safer option in her case. Pros and cons of recommended method of contraception: frequency of application, side effect, duration of action, and reversibility. Why Depo and Nexplanon are not preferred options. Obtain consent to insert IUD. Okay, Myrin or IUS. Information gathering: focused history, menstrual history, sexual history, obstetric history, medical history, smear history, contraception history, check weight and blood pressure, you checked it. Thrombophilia screening, this may be necessary. Review obstetric records, notes you reviewed. Clear investigation for thrombophilia. Perform pregnancy test to rule out pregnancy. Okay. Communication with colleague is knowledge, writing back to a GP. Patient safety, patient details, safe drug, safe prescription, discuss the reasons why other methods of contraception cannot be used, able to determine when to insert IUD, make sure that patient is not pregnant, offer appropriate advice after inserting the IUD depending upon the day of the cycle, education on whom to seek for help, indication for the string not felt, missed period, irregular periods, abnormal discharge, suspected pregnancy. Applied clinical knowledge, most suitable option LARC. Why? Contraindication to COC, timing of insertion, counseling, advice on post-insertion care. Demonstrate knowledge about NICE, LARC, FSRH, RCOG guideline on contraception. Demonstrate having up to date knowledge about contemporary literature. Overall, a good task done by you, dear. Thank you, really thank you.
Thank you so much.